Hello. My name is Melissa. I'm the therapist here. Um, I believe your name is Sam. Welcome in. I wanted to ask you, what is the presenting issue that brought you into therapy today?
Hi, nice to meet you, Melissa. I'm currently seeking treatment because I've been having a hard time transitioning from high school to college. I've been struggling with making friends. I've also been very anxious, and it's just hard for me being far away from home. I'm actually 10 hours away from home. So it's difficult.
Okay, yeah, of course. And is this your, you said it's the first time being away from home this far?
Yes, it's my first
Okay.
time, and I actually grew up with my whole family being in the household, and I was very close to my siblings, and
Right.
it's just very different for me.
Of course. Yeah, I see how moving away from your family for the first time could be a little bit different, and it takes some time to adjust. Um yeah, since you brought up your family, I'm wondering, what kind of relationships did you have with your parents and your siblings?
So, I was actually very close to both my mom and dad. They're literally like my best friends. As for my brother and sister, I also get along with them, but since I am the baby of the family, we do sometimes fight here and there. But
Right.
it's something that I do miss. I miss having them around.
Oh, yeah, of course. Well, I'm glad to hear that you have a good relationship with your parents and your siblings for the most part. I did want to ask a little bit about your family. So, did you grow up with a specific culture or traditions that you kind of carry on now?
Yes, so my family, um, they migrated from Jalisco, Mexico, and they used to be Christian. I mean Catholic, but now we're practicing Christianity. And for
Okay.
me, I've always been into like going to church every Sunday, participating in like a youth group. But ever since I moved here to my college campus, it's been hard. I kind of like drifted away from that, and I feel embarrassed now to even go back.
Okay. Yeah, I see that faith and Christianity was a big part of your life. Um, I do want to touch on that you said you feel embarrassed. Is there a specific reason why you feel embarrassed?
Yes, I feel like within my Christianity beliefs, I've actually started doing things that wouldn't be accepted in the Christian church.
Okay.
I do self-medicate now, and it helps me with my anxiety. I started using weed ever since and coming into my fall semester,
Mm,
and I it's just been able to help me calm my anxiety and just like talk to others or even talk within class.
right. Okay. So I hear that you have self-medicated with using weed lately in the most recent months because you believe it helps you with your anxiety.
Yes.
Is so then do you feel embarrassed that maybe your family will think something of it, or is it more of like you think the church and like your faith, it yeah, what who do you think is more where do
No,
you feel the embarrassment coming from?
for me, it would be both parts, especially within the promise I made within church, which was following our 10 commandments and making sure that I'm always on the right path. And then just letting my parents know that I am self-medicating would break their heart just because they hold
Right.
me in this high pedestal of me being the perfect child. And just telling them about this breaks my heart.
Right. Okay, I see. Since you did bring up use of a substance, I'm wondering, has there been any other substance use in the past? So before these few months?
No, it would just be weed that I've done.
Okay. Okay. Yeah. Well, thank you for telling me that. Um, I did want to move on a little bit to any, so you said substance use has not occurred in the past, it's just most recently. What about, has there been any history of mental health within you in like past years?
So within mental health, I've never really seeked counseling. This is actually my first time, and it's I've only seeked it because I realized that I'm not myself anymore.
Okay.
And within my family, we typically just put our mental health on God and pray it off. And now I feel like that isn't working for me, and I just really need some guidance and help within that.
Okay, yeah, of course. Well, because this is your first time coming to counseling, I do want to applaud you on that. Applaud you on seeking help, and yeah, welcome to counseling. Um, but yeah, okay, awesome. So no past history of mental health. What about family? Has there been any family members that have had a history of mental health?
So within my family, we do have a stigma on mental health, but from what I've seen is that there is some of my family members that also have anxiety, and some of them even have depression as well.
Okay. Is that more so like have they been diagnosed or is it something that they're going to counseling for?
So one of my aunts, she is going to counseling and she has been diagnosed with depression and anxiety. But within my family, we just, because of the negative stigma, they always just disregard her and let her know that that isn't true. We should just pray it off.
Okay, I see. Okay. Thank you for sharing that. Um, has there been any um physical health issues in the past, maybe symptoms that you've experienced years prior?
For physical health, I would say no. I've been completely good on my physical exams and just my well-being. I feel like I did started to notice some change within my sleeping habits. I'm
Mm.
not getting my full 8 hours of sleep. I've been having a hard time even just like resting. I've been feeling some body aches as well.
Okay, yeah. Okay, thank you so much for describing those like physical symptoms that you're sometimes feeling. Do you think that that has to do with the anxiety that you're experiencing, or do you think they might be related to something else?
I feel like definitely with the anxiety I'm experiencing, I notice that when I have myself overthinking and just having these flowing thoughts, my head starts to hurt. I start to feel some tension on my muscles and my eye sometimes twitches.
Okay, yeah, I see what you mean. Thank you for sharing that. Um, I do want to move on to, oh yeah, your social history. Can you tell me a little bit about maybe how social you are right now? I know you are in college. College is a time to be a little bit social, but how would you describe your social situation?
So for my social history, I don't have any friends here at college. I do live in a single dorm. It's very hard for me to make friends, I am especially since I'm very shy already as a person, and just the feelings that I get of like a racing heartbeat when seeing someone
Mm.
come up to me, I just like start turning red and I feel like I can't breathe and I want to avoid that. So it's been a challenge for me to make friends.
Okay, yeah, I see. Have you put yourself in a place where in a social situation maybe like on campus, maybe joining a club or like a get together? Have you tried any of those kind of social events?
Yes, I actually did try one. It was a Greeks and social clubs week.
Okay.
And during that activity, I've actually started feeling really anxious. So I ran back to my dorm just because I got very overwhelmed.
Okay, I see. Thank you for sharing that. Can I ask a little bit about your social situation and social history back at home? So when you lived at home.
Yeah, so back at home, I've actually had lots of friends. I was very involved in my church. I was also very involved in different sports at school and clubs as well. I was
Mhm.
the class president, and now it's just something different. I don't feel like myself.
Okay, I see. Yeah, so it seems like a little bit of a change from when you lived at home till now. Yeah, okay. Has there ever been a history of trauma in your life?
No, there's no history of trauma. I'd like to say that I grew up in like a perfect household with both loving parents.
Okay, awesome. That's really good to hear. With that, I did want to ask if you've ever had thoughts of hurting yourself or hurting others.
No, I've never had any thoughts of hurting myself or hurting others.
Okay, thank you for sharing that. Um, do you currently have any thoughts of hurting yourself or others? I just kind of want to differentiate between the past and now. Is there any current thoughts?
No, not at the moment.
Okay, thank you for sharing that. Um, Lastly, I do want to ask about a little bit more about your culture. I know you said that you grew up with a two-parent household and that you grew up with Christianity, and that's something that you practiced. Can you tell me more about your culture? Yeah, your roots and what you practiced at home, maybe.
Yes, so within my household, we would go to Sunday mass every day, and then we're also involved in a youth group. My siblings and I would always go every Wednesday. And my family and I are very proud of our culture. Like I mentioned, we are um, immigrants from Mexico, and
Right.
we do have
Okay.
practice some of our cultural beliefs here.
Awesome. That's really, really awesome to hear. Is your culture, I know it sounds from what you're saying, it sounds like your faith is really important to you. Is your culture something that is also important to you?
Yes, it's very important, and I'm very proud to be Hispanic.
Awesome. That's really awesome to hear. Um, is there, I mean, would you like to continue practicing your culture now, even though you are away from home?
Yes, it's something that I would still want to keep practicing. And I also want to get back into attending church, but I just haven't found that community yet. And
Yeah.
yeah.
Awesome. And then do you feel like these symptoms that you are describing, these anxiety related symptoms, do you feel like that is kind of stopping you from either practicing your culture or practicing your faith?
Yes, they definitely are impacting me,
Oh,
especially with the self-medicating. I I just feel really embarrassed and I feel like I shouldn't even step foot in the church again.
okay. Can I ask how often you do self-medicate?
I self-medicate every day,
Every
and
day.
I do it in the morning and before I go to bed.
In the morning and before you go to bed. Okay. Got it. When you do self-medicate, um, do you do it alone? Um, do you do it with others? What does that look like? And then maybe where do you do it?
Mhm. So I do it off campus since we are a smoke-free campus. I usually go to a park and I go by myself. And usually the times I go would be around 7 a.m. and then during the nighttime I would go around 8 p.m.
Okay. I see. Yeah. Okay. So I hear you say that when you do use a substance, you use it in the morning and at night, but you go to a park to do it there and not on campus in your dorm. Is that correct?
Yes, correct.
Okay. Good to hear. Thank you for telling me that. Yeah, okay. Well, thank you so much, Sam. I feel like we got a lot of information today. Thank you for doing this intake interview with me. I'm hoping that we can continue counseling and work on some of these symptoms and the presenting problem that you have. Do you have any questions or comments for me?
No, I don't have any questions, but I did want to ask when our next session would be.
Yeah, so we can schedule our next session for next week. Um, I'll send you over a link where you can look for the days and times that best work for you.
Okay, thank you so much. I'm very excited to start counseling.
Thank you so much. I'm excited to work with you. Bye.
Bye, have a good day.